Imagine you are ready to start a productive and busy day at the college. You're prepped, ready, and excited to do all your clinical and laboratory works. But wait, you go to grab your gloves and they're gone. You check the storage for sterilization pouches, nada. And what about those single-use items you needed for your procedure? You're hunting through drawers, crossing your fingers that the supplies are there. It's chaos. This is a real challenge for a lot of dental schools and clinics, keeping track of all the supplies, especially when there's so much going on. Without a proper system, resources can go missing, materials can be wasted, and things can get a little messy. And waste management? It's a huge problem we often overlook, but it's right there in front of us. Unused supplies piling up, expired materials being tossed out, and single-use plastics that seem to multiply by the day. But what if there was a way to make this whole process easier? A simple tool to track what you have, where it is, and how much you need. Imagine an app that keeps everything organized, minimizes waste, and makes sure you're never scrambling to find your materials again. Here's where DenTrack comes in. This mobile app is designed to make inventory management and waste tracking at UPCD a breeze. With features like real-time tracking, QR scanning, and low stock alerts, DenTrack will keep everything running smoothly. You'll never have to guess when it's time to restock or waste valuable time looking for missing supplies. DenTrack brings order, ensuring everything you need is right where it should be, when it should be. Now, let's explore how DenTrack will transform the way we manage dental supplies, reduce waste, and streamline workflows in the laboratories and clinics. So, what exactly is DenTrack all about? In a nutshell, it's a solution to the long-standing issues faced by UPCD in managing dental supplies and waste. This innovative system will track inventory, monitor waste in real time, and ensure that UPCD is operating efficiently and sustainably. By integrating a user-friendly mobile app with cloud-based technology, DenTrack will simplify tasks, reduce waste, and contribute to a greener future for dental education. Let's take a look at what DenTrack can do. First up, real-time inventory management. With DenTrack, every time supplies are used, they're automatically updated and tracked. No more overstocking or scrambling to find what's needed. Plus, when stock runs low, DenTrack sends an alert to make sure you're always prepared. No last-minute panic. Next, waste monitoring with DenTrack ensures there's a balance between what clinicians use and what they record as waste. This helps us keep track of materials so nothing gets overlooked. It's all about ensuring the input and waste records match up for a smoother, more sustainable process. But why is DenTrack so important? This isn't just about tracking materials. It's about completely changing the way we manage resources. With DenTrack, UPCD can be more sustainable, more efficient, and better prepared for the future. It's time to step into the digital age and optimize everything, from the clinic and laboratory floors to the environment. Currently, UPCD relies on manual tracking for supplies, which leads to errors, stockouts, and delays. This method not only wastes time, but also promotes unsustainable practices, especially when it comes to waste. DenTrack aims to change that by integrating cutting-edge technology into UPCD's operations. The app will provide efficient supply tracking and responsible waste management, ensuring UPCD leads the way in sustainable dental education. The idea behind DenTrack is simple: to integrate cutting-edge technology with the everyday operations at UPCD, creating a system that tracks dental supplies efficiently and ensures that waste is handled responsibly. By leveraging mobile apps and cloud-based solutions, DenTrack will streamline these processes, making UPCD a leader in sustainable dental education. The project focuses on two key areas within UPCD's dental clinic and laboratory operations: inventory management. tracking and managing dental supplies like gloves, masks, head caps, and other consumables. Waste monitoring, ensuring that waste is segregated, tracked, and disposed of in the right way, reducing environmental impact. The system will also offer automated reorder notifications, ensuring that supplies are always available when needed. Essentially, Dentrack transforms how UPCD handles its everyday resources, moving from a manual, error-prone system to a sleek digital one that improves efficiency, reduces waste, and saves costs. Who benefits from Dentrack? The primary beneficiaries are the students and faculty at UPCD. Students will be trained in sustainable resource management, while faculty will enjoy smoother workflows without the hassle of manual supply tracking. Patients also benefit, as better supply management leads to fewer delays and more efficient care. Plus, Dentrack helps reduce waste, aligning with UPCD's environmental goals and creating a cleaner and brighter college. Who's backing the project? UPCD is the driving force, providing the support and funding to bring Dentrack to life. Faculty and students will offer invaluable feedback, ensuring the system meets real-world needs. Technology partners will turn the concept into a fully functional app, while environmental groups will guide the waste management aspect, ensuring eco-friendly practices. Government agencies like the DENR and DOH will recognize the potential of Dentrack to positively impact public health and sustainability. The Philippine Dental Association and global organizations like the FDI World Dental Federation may also support this project, seeing it as a model for sustainable dental education worldwide. Now that we have a clear understanding of the challenges at UPCD and how Dentrack can make a difference, it's important to focus on what we aim to achieve with this project. For our vision, Dentrack aims to establish UPCD as the most sustainable, environmentally conscious, and innovative dental school in the Philippines, leading the way through proper management of waste and promoting effective solutions for a greener and brighter future for healthcare. With this, our mission is to optimize the inventory and waste management in the UPCD laboratories and clinics through a user-friendly system, ensuring efficient resource use, reducing shortages, and promoting environmentally friendly practices, improving the efficacy of the clinics through a synergy between students, suppliers, waste collectors, and staff. For our objectives, Dentrack aims to implement a student inventory management and trash monitoring system that optimizes stock and waste management at the UPCD. The overarching goal is to improve operational efficiency while minimizing environmental impact. Specifically, implement real-time inventory tracking and automated reordering alerts for each UPCD student's use of disposable materials, preventing supply shortages and overstocking. Reduce supply shortages and overstocking by 90% and waste generation by 50% within the first year of operation. Train 100% of UPCD students to use the system effectively within 6 months. Ensure the system enhances operational efficiency and supports UPCD's sustainability goals. And lastly, fully implement the system within 18 months, ensuring its seamless integration into daily operations. Let's break down how Dentrack stacks up against a Telos framework. Think of it as a reality check to make sure the project can actually happen. For the technical side, Dentrack is designed to run on a cloud-based database and a mobile application accessible on both Android and iOS. This means students and clinicians can track inventory and waste in real time, no matter where they are. It's like having a digital assistant that never takes a day off. The only catch? We'll need to ensure training is in place so everyone knows how to use the system effectively. The Department of Information and Communications Technology and the Department of Science and Technology can provide guidance and support to make this happen smoothly. The initial investment may seem high, developing the system, training staff, and purchasing the necessary equipment. But it's an investment that will pay off. With better inventory management and reduced waste, UPCD can save money in the long run. Plus, cost-sharing opportunities with agencies like DENR or corporate sponsors could help fund the project. Compliance is key. DENTRAC must align with Philippine regulations like the Ecological Solid Waste Management Act for waste management and the Data Privacy Act to protect sensitive data. The Environmental Management Bureau and local government units can provide guidance to ensure DENTRAC follows these rules and regulations. For DENTRAC to work, it has to be adopted by everyone, clinicians, staff, and students. The challenge here is making sure the system fits seamlessly into existing workflows. To make it easier, we can encourage regular use through incentives, like recognition programs or simple compliance checklists. Training will also be key to ensuring everyone knows how to use the system. The 18-month timeline may seem ambitious, but with proper planning and a phased approach, think pilot testing, feedback, tweaks, we can make it happen. Engaging early with DICT, DENR, and LGUs will help keep things on track and avoid unnecessary delays. Now that we've looked at the TELOS framework, let's shift gears to the SWOT analysis to see the bigger picture. What DENTRAC excels at, where it might struggle, and the opportunities and challenges it faces. Let's start with the strengths. DENTRAC has some serious advantages. It's the first system of its kind at UPCD, focusing on sustainability and efficiency. That's a big deal. On top of that, partnering with Dean Michelle Segarra is a huge plus. Her vision of green dentistry aligns perfectly with what DENTRAC aims to achieve. This system addresses real gaps in inventory and waste management, making processes more organized and eco-friendly. And being part of an institution like UP, which supports innovation and values its students, adds even more credibility to the project. Of course, no system is without its challenges. DENTRAC relies heavily on everyone involved, students, faculty, and staff. If they don't participate consistently, the system could lose its effectiveness. And let's not forget the realities of student life. Everyone is busy, and finding time to coordinate and develop the system could be a struggle for the project team. The opportunities for DENTRAC are really exciting. Government agencies like the DENR and DOH could step in as valuable partners, offering both guidance and support. Beyond UPCD, there's so much potential to expand the system to other dental institutions, both here in the Philippines and internationally. Imagine DENTRAC becoming a model for sustainable dentistry. It's a game changer. On the flip side, there are some threats to consider. Budget cuts in state universities like UP could limit resources for further development and maintenance of the system. Resistance to change is another hurdle. Shifting from manual processes to a tech-based system might take time, and not everyone may be on board immediately. These are challenges we'll need to address to ensure success. Now, let's dive into the first part of our methodology, the conceptual model. This model explains how our system works and how everything connects in our system. First, there's the student. The student is responsible for entering information about dental supplies and trash disposal into the system. They interact directly with the central monitoring system, which helps manage both stock and waste. The system also provides stock management for students, ensuring that they always have the right amount of supplies without overstocking or running low. Next, we have the dental material suppliers. These suppliers input their products and categories into the system, allowing students to see what's available. Through the system, students can place orders and suppliers can process deliveries. The system tracks the order and delivery process, facilitating smooth interaction between the students and the suppliers. Then, there are the trash collectors. They input the trash pickup schedules into the system. When it's time for a pickup, the system alerts the trash collectors so they know when to collect the waste. The trash collectors are also responsible for segregating the waste, ensuring proper disposal or recycling. The system helps facilitate this process, ensuring that everything is sorted correctly. Finally, we have the UPCD staff. They oversee the entire system and have the ability to supervise both inventory and waste management through the system. The UPCD staff ensures that the students and trash collectors follow the correct procedures. Additionally, they can input feedback into the system, such as announcements, alerts, or notifications related to inventory or waste management to keep everyone informed and compliant. This system works together to keep the inventory organized, the waste managed properly, and the laboratories and clinics running efficiently. Now, let's shift gears and explore some related literature that supports our project. A recent study by Si Hombing examined issues like poor stock tracking and delayed orders. But here's the good thing. The study found that implementing agile methods of flexible adaptive approach helped create an inventory system that effectively addressed these problems. The system was not only efficient but also user-friendly, with high approval from staff. The takeaway? Agile inventory systems can significantly improve clinic operations, ensuring that supplies are tracked properly and that materials are used before they expire. These same principles can apply to other healthcare sectors facing similar issues. Next, research from Monica et al. Found that many dental professionals fail to properly dispose of hazardous materials. Similarly, Duane et al. Emphasized the need for waste monitoring systems to ensure proper waste management. These systems help track disposal, ensuring everything is handled safely and responsibly. A great example of using technology for better waste management comes from Fascio et al. They introduced real-time tracking to optimize waste collection and disposal. The results? Lower costs, reduced emissions, and a smaller environmental footprint. This shows that applying technology to waste management can bring big environmental and operational benefits. Another one is according to Field et al., who talks about integrating sustainability into dental education. Teaching students about eco-friendly materials, digital records, and waste reduction practices prepares them to make more sustainable decisions in the future. This shift in education could transform the dental industry, making sustainability a core value. Duane et al. Also stressed the importance of adopting green practices in dental clinics, such as reducing energy use, recycling, and cutting emissions. This broader focus on sustainability means dentists need to consider the environmental impact of their daily practices. Finally, let's look at a real-world example of sustainability in action. The UPCD has been a pioneer in green dentistry. According to Ligtas, UPCD is leading the charge in the Philippines by focusing on waste reduction, energy conservation, and cutting out hazardous toxins in dental practices. In May 2024, UPCD conducted the country's first ever waste audit in collaboration with Healthcare Without Harm. This audit helped identify issues like improper waste segregation and high plastic waste. But more importantly, it set the stage for implementing more sustainable practices aligning with global goals for reducing healthcare-related pollution. Now that we've explored the context, let's take a closer look at our project plan and how DenTrack will make a difference. First, we'll define what DenTrack needs to do: track dental supplies and monitor waste. The app will allow students to check stock, receive low stock alerts, and reorder supplies automatically. For waste, students will manually update and schedule pickups to make sure nothing gets missed. Next, we'll bring the plan to life. The app will be developed for both Android and iOS to ensure easy access for everyone. We'll then test DenTrack with a small group of 5 to 10 students over 2 months. Their feedback will help refine the app. Faculty, staff, and students will also receive training to ensure everyone knows how to use it. After testing, it's go time. DenTrack will be fully deployed. We'll closely monitor its performance and quickly address any issues that might arise. To evaluate DenTrack's effectiveness, we've planned several key strategies. First, as mentioned, we're putting DenTrack to the test with a group of 5 to 10 third-year students and clinicians over 2 months. They'll use it for tracking supplies and reordering, and will measure how long it takes and how easy it is. The goal? Spot any hiccups and get valuable feedback to refine the app. Before users dive into DenTrack, we'll give them a quick quiz to see what they know. After training, they'll take another quiz to see how much they've learned. We're aiming for a 90% success rate, so everyone will be ready to master inventory and waste management. Next, we're tracking real-world numbers like inventory turnover, shortages, and waste. Our goal is a 90% reduction in both stockouts and overstocking, plus a 50% drop in waste within the first year. We'll compare these numbers with what we had before just to see how much DenTrack is improving things. We're all about green goals, so every month we'll check that DenTrack is helping reduce waste and promote eco-friendly practices. By reviewing inventory and waste logs, we'll make sure we're hitting all the right sustainability targets. Once DenTrack is fully up and running, we'll send out a survey to gather user feedback. We want to know how it's going, what's working, and what needs tweaking. This final check will help us make sure DenTrack is the perfect fit for everyone. The core of DenTrack is all about sustainability and efficiency. The system mirrors UPCD's commitment to creating a greener, more responsible campus. By cutting down on waste and optimizing supplies, it helps us shift toward eco-friendly practices in dental education, making every action count toward the future. The success of DenTrack depends on everyone at UPCD. Faculty, clinicians, and students will receive training to use the app efficiently, while IT staff will ensure everything runs smoothly. Waste management teams will play a critical role in maintaining compliance and ensuring that the system is used correctly. The leadership at UPCD, particularly Dean Michelle Segarra, will be the driving force behind this project. Their support will keep everything aligned, coordinate efforts across teams, and ensure the project stays on track. The leadership's involvement is essential to the system's success. Finally, let's look at organizational support. Partnerships with agencies like DENR and DOH will provide the backing needed to develop and implement DenTrack. Their expertise in waste management regulations and access to funding will be key in ensuring the system's success. While DenTrack is set to revolutionize resource management at UPCD, it's important to consider the project's constraints and limitations. The DenTrack system will start by managing inventory and waste tracking for third-year students, expanding as they progress through their studies. Initially, it will focus on materials for subjects like dental materials and radiology, with plans to cover more advanced areas in later years. However, for DenTrack to work efficiently, it's essential that everyone uses the system properly, regularly updating materials in inventory. Adherence to local laws, as mentioned earlier, may also add extra costs or time for adjustments. The project is scheduled to take 18 months. The first 6 months will focus on system development, followed by pilot testing with third-year students. This is followed by 4 months of training to ensure that the implementation phase goes smoothly. After refining the system, the final 6 months will be for implementation, complete with monitoring and assessment to make the necessary optimizations to improve the system's functionality. The estimated cost for the project is 2 million pesos. The biggest expenses will go towards system development, which is 700,000 pesos. Hardware like tablets and scanners will be 500,000 pesos, and waste management setups will be 300,000 pesos. Training materials will cost 200,000 pesos, and the rest will go to pilot testing and maintenance. It's essential to secure funding early to keep everything on track and avoid delays. Let's now look at the project's estimated timeline running from January 2025 to 2026. The Gantt chart outlines this process step by step, ensuring efficient development and implementation of DenTrack. The first phase involves aligning key stakeholders, clinicians, department heads, and IT staff to discuss the project's objectives and scope. This phase will produce a project charter, a TELUS feasibility report, and the IT-POS mode-based resource plan. Next, we move to design and development. This phase will include the creation of context diagrams and models for DenTrack, followed by the development of the mobile app and cloud database. Key features like real-time tracking, QR scanning, automated reordering, and compliance checklists will be integrated, leading to the creation of the system prototype. Once the prototype is ready, pilot testing will begin. This phase will assess the system's efficiency and functionality with feedback gathered from users to identify bugs or areas of improvement. The feedback will guide the final version of the system. Training is the next step, ensuring that faculty, staff, and students are fully equipped to use DenTrack correctly. This phase will include the development of training materials. With training complete, DenTrack will be deployed across the college. Thanks to prior preparation, the transition should be smooth. Successful deployment will mark the conclusion of this phase. After implementation, post-deployment monitoring will begin. The performance of DenTrack will be continuously assessed, and recommendations for improvements will be made based on feedback from users. Imagine a future where managing dental supplies and waste becomes effortless, running seamlessly in the background. That's the vision behind DenTrack at UPCD. It's more than just an app. It's a transformation in how we handle resources. By simplifying inventory tracking, managing waste efficiently, and streamlining workflows, DenTrack will revolutionize daily operations, making the system more sustainable, efficient, and organized. Aligned with UPCD sustainability goals, DenTrack also supports the national environmental agenda and invites collaboration with organizations like DENR and DOH. These partnerships will enhance credibility, providing funding opportunities and help achieve public health goals. With full backing from UPCD leadership, the involvement of key stakeholders, and the commitment to ongoing improvement, DenTrack is not just a tool, it's a movement that empowers students, enhances patient care, and paves the way for a greener, more efficient future in dental practice. This has been Group 1 with DenTrack, and thank you for listening. Here are our references.